Hello. Thank you very much for this wonderful opportunity that you have given me to talk about planetary health and the role of family medicine and how family doctors can be an important player in the healing, not just of the health of people, but also of the health of the planet as well. And I just want to start by welcoming you to the planetary health era. As you can see in this diagram, we are now facing many different challenges that are shaped by our surrounding environment. And many of these ecological damages are inflicted upon by us, human beings, through our many different human activities. As you can see here, our consumption patterns, the demographic shifts that we see, like urbanization and migration, technological advancement, all of these create different kinds of environmental problems, such as global pollution to the air, water, and land, loss of biodiversity, climate change, among many others. And all of these eventually affect the health of human populations, as you can see on your right. This is what the planetary health era is all about. Our health is shaped by the surrounding environment, which in turn is also shaped by our many different activities and decisions. And so I always remind my medical students, our learners, our younger health professionals, that in this day and age, we are now trying to treat not just one kind of patient, but two kinds of patients. On one hand, you have that kid wearing a face mask, trying to protect herself from the unseen coronavirus, or perhaps dirty air pollution in the city. But on the other hand, you also have Mother Earth also wearing a face mask, of course, not to be protected from SARS-CoV-2, but instead to be safeguarded from the myriad ecological damages that we're inflicting on her as a result of our irresponsible human activities and decisions. So again, when we say planetary health, we now have two patients, not just the people, but also the planet. The health of the people, our health, is deeply intertwined, in fact, even inseparable from the health of our planet Earth, our natural ecosystems. And I'm reminded by what one of the pioneers of climate and health, the epidemiologist Anthony McMichael, said in the 1990s in a commentary. He mentioned, or he stated here, that the health sector must lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda. And I think that this radical extension that he was talking about in the 1990s is what we now call planetary health. And as you can see at the bottom, he is urging all of us to develop an ability to collaborate with unfamiliar disciplines such as climatology, ecology, economics. I always remind my medical students that by the time they graduate, if they really want to make a difference in planetary health, they should have acquired at least 5 new friends who are not from medical school, maybe a social scientist, an environmentalist, an engineer, an economist. Again, because this radical extension of the health agenda, which is now what we call planetary health, requires a truly transdisciplinary approach. You might be wondering, oh, this term planetary health sounds new, but this is really not a novel invention. This idea that the health of people and the health of the planet are inextricably intertwined. This idea has been existing for centuries, if not millennia. We just need to go back to indigenous wisdom, to ancient cultures. In fact, according to Chief Seattle, one of the indigenous leaders of the Americas, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. Isn't that the planetary health message that I described to you a while ago? We inflict harm, we inflict damage on planet Earth, and all these problems return back to us in the form of human disease, disability, despair, if not death. So now, I'm sure we're all familiar with the many different ways by which we measure the health of human populations: life expectancy, maternal mortality ratio, infant mortality, among others. But there is also a framework for measuring the health of the planet as well. And I want to introduce to you the concept of the planetary boundaries. When we say something is a boundary, it means these boundaries or limits cannot be violated or breached. Because if we do so, it makes planet Earth less conducive for the survival and the thriving of all life forms, including ourselves, human beings. And so, as you can see in this diagram, there are 9 planetary boundaries that have been already identified by the Stockholm Resilience Center in Sweden. And out of the 9 planetary boundaries, 6, unfortunately, have already been violated. Here you will see the 6 boundaries. Those are the ones in red. And the ones that are violated include the boundary for climate change, biosphere integrity or biodiversity loss, because over the past century, we've seen the fastest rate of extinction of creatures, great and small. Land system change, we've been turning every natural ecosystem into subdivisions, golf courses, shopping malls, or new cities even. Freshwater change, our lakes and rivers are now not only overconsumed, but also overcontaminated. The biogeochemical flows of 2 important elements in nature, phosphorus and nitrogen, have already been destabilized, disrupted as a result of our global addiction to artificial fertilizers in the pursuit of large-scale agriculture. And last but not the least, the boundary for novel entities, compounds, molecules that we invent in the factory and the laboratory, and we release to the environment. And now they can be found everywhere, in the soil, in the water, in the air. And one of the finest example of this is plastic, which is now not only floating in our oceans and seas, but also flowing in our bloodstream, according to recent studies that have been published over the past 2 years. So we now have 6 out of 9 boundaries already violated. And this should be a cause for alarm for us in the health sector. But it's also not enough that the boundaries of the planet are respected, are preserved. We need to make sure that in doing so, we're also advancing the health and well-being of people. And so this British economist, Kate Raworth, came up with this new model for the future economy, an economy that respects the planet's boundaries, while at the same time preserves and advances the health and well-being of people living on planet Earth. And this is what she called the donut economy. As you can see, it looks like a donut. And basically, the future economy of the world, the future society, should be operating within what she describes as the safe and just space for humanity. The space between the outer circle of the donut, which is the planetary boundaries or the ecological ceiling, and the inner part of the donut, which is pertaining to the social foundation, things that we need for our survival and flourishing: water, food, health, education, political voice, jobs, housing, among others. So it's easier said than done, of course, and we have a big challenge to make sure that we redesign an economy, a society that again respects the planet's limits, while at the same time ensures our health, well-being, and flourishing. And so, in fact, there's one study that investigated the different countries in the world. They asked the question among the countries of the world, which is the one that is closest to becoming a donut economy. And here I'm showing to you donuts of 3 neighboring countries in Southeast Asia. You have Singapore, as you can see, that it almost already achieved its basic social foundations. There are not many reds in the inner part of the donut. But as you can see, almost every planetary boundary that has been allotted for Singapore has already been violated or breached. Meanwhile, our beloved country, the Philippines, as you can see, no reds in the outer circle. That's good news. We have not yet exceeded the planetary boundaries that were allotted to us as a country. But as you can see, there's so many reds inside. And that speaks to the unfinished business that we have as a nation, as a society, to achieve many of the sustainable development goals like health, housing, energy, jobs, gender equity, so on and so forth. It's interesting that in this same study, the country that was deemed or found to be closest to becoming a donut is a country that is very close to us, our neighboring country of Vietnam. And as you can see, it only has violated one planetary boundary only to a minimal degree. And it almost already achieved the basic social foundations for its citizens. So maybe the question that we should now be asking is, how can we be like Vietnam? So I just gave to you an introduction to the basic principles of planetary health, the need for transdisciplinarity, the need to think in terms of systems and the long term, and balancing the planet's health with human health and well-being considerations. Now I just want to focus on one of the planetary boundaries that I mentioned to you a while ago, which is climate change. And climate change, we know, is a pressing, if not an even existential threat that we are facing now, which affects the health of human populations. This diagram shows to you that climate change affects health in many different ways. There are many arrows, different boxes. Climate change events like storms, drought, floods, and heat waves affect health directly, but also indirectly by operating through the social and the environmental determinants of health. And on your right, you will see that there is really no single disease group that is going to be immune to the impacts of climate change. In fact, and I invite you to visit this website or webpage from the New England Journal of Medicine, a very interactive webpage. You click on the organ system, and it will tell you how that organ system is going to be affected by climate change. The lesson or the message is that every specialty, every clinical specialty has a role to play in tackling climate change and its health effects. And family physicians, as being general practitioners covering many different organ systems and disease conditions, are in the best position to really apply a whole of human body and whole of public health approach to addressing climate change and its health effects. So in the coming slides, I'll just do a quick rundown of the different effects of climate change on human health, especially in the Philippine context. Over the past 4 years, we have witnessed the confluence between two types of crisis. On one hand, you have COVID. On the other hand, you have climate. And imagine you're a poor Filipino living along the coastlines, living along the corridor of the typhoon, and you are confronted with the dilemma. On one hand, do I stay in the house to protect myself from the unseen coronavirus, only for the roof of my house to be blown away by the strong wind? Or on the other hand, do I move to these cramped evacuation centers safe from climate-related disaster? But as you can see in these temporary shelters, there's very little social distancing or physical distancing that is happening to begin with. And so there's a very high chance that you will be contracting the unseen infection. But it's not only the wet phenomena of climate change that we in the Philippines have been experiencing. Over the past several weeks, I'm sure you have also experienced directly the extreme heat that is now affecting not only the Philippines, but many parts of Asia Pacific. And heat is going to be the next public health threat that we must brace for, that we must prepare for, that we must tackle and address. As you can see in this series of maps, our region will continue to be a hotter region in the years and decades to come. And we expect more of school closures and shift to remote learning and work as we confront the effects of a warming planet. And so we need to establish heat resilient public health systems and societies in general as we encounter more of these occurrences in the years and decades to come. The climate is also influencing the pattern of infectious diseases around the world. As you can see here, climate change is going to affect the epidemiological triad, the behavior of the pathogen, the status of the host, and the conditions of the environment. And when this happens, we expect more of the familiar infectious diseases, diseases that we've been trying to eliminate for a very long time, to resurge, to increase in number and magnitude again. But we're also experiencing and we're also expecting emerging infectious diseases to come. And we've seen one of them already in the past several years, COVID. We anticipate more of diseases like that to emerge in the years to come. And then we also need to start looking at nutrition, because our nutrition is also very interconnected with the health of the planet. The very same food system that creates undernutrition because of the inequitable access to food experienced by many people around the world, as well as overweight and obesity as a result of increased calories, nutrition, among many other reasons, including lack of physical activity. All of these are created by the same food system, which is also emitting its own carbon and also has its own environmental impact because it's also using water, soil, energy. And so, this food system needs to be tackled in a more holistic approach rather than just looking at specific micronutrient deficiencies or specific health conditions. And so I encourage our family doctors to look at the food system and to come up with solutions. For example, this type of diet that was introduced in a 2019 report called the Planetary Health Diet, a diet that is not only good for the people's health, but also the health of the planet as well. And as you can see in the plate, if we're going to consume it in a meal, it means half of the plate must be comprised of vegetables, of greens, almost a quarter with whole grains, not refined grains, and a very small portion is dedicated to red meat, animal source protein. In fact, if you're going to translate it into a week-long diet, if you're eating 3 times a day, 7 days a week, 21 meals in total, you only are allowed to eat meat in one meal out of the 21 meals. I wonder if the Filipino populace is ready for that kind of dietary shift. And I already mentioned a lot of the physical health impacts of climate change, but I also want us to remember that climate change is also a mental and emotional health issue. It affects the health of our brains and our hearts. And of course, when a typhoon hits a community, people are displaced, forcibly displaced from their houses. They lose their livelihood and many other resources. And they can acquire different levels of post-traumatic stress. Some can last for weeks, and some people experience this trauma even for a lifetime. But also, we are now starting to look into new forms of mental health impacts of climate change, the different psychological responses to climate change, such as what we now call climate or eco-anxiety. This is something we're now looking at in the Philippines. In fact, there is a 10-country cross-sectional survey that was published in 2021, and it was found out that the Filipino young people, among those who were surveyed, are the most climate anxious in the world. They're afraid about their future. They are not anymore interested to procreate. They are worried about their jobs, their livelihood, and even for their future children. So I just showed to you the wide array of impacts of climate change on human health. And we expect more of these to emerge in the years to come, especially when you see in the news that the UN climate chief saying we only have 2 years remaining to save the planet. Or scientists saying that we do not have until 2030, we only have until 2027 to make sure that we do not violate or breach the climate boundary that is allocated for us. And so the question that we should be all answering is, are we ready to build health systems that consider the climate? Are we ready to prepare the next generation of health professionals or of physicians, of family doctors who do not only care for people, but also care for the planet as well? Are we ready to reorient the health community towards planetary health values, embracing sustainability, intergenerational equity, systems thinking, among others? And so in the next several slides, I'll show to you some of the potential solutions that are within reach that we can already deploy in our health systems and in our clinical practice. I want to introduce a new term called climate smart healthcare. And when we say something is climate smart, it's at the convergence between sustainability on one hand, making sure we do not pollute, we do not add to the environmental footprint. It's low carbon, green, environmentally sustainable. We're not an accomplice to the climate crime. We are not harming the planet. And on the other hand, we should also be resilient and adaptive, like the bamboo, bending without breaking. We can continue our business, the functionality of the health sector, even in the face of climate-related shocks and stresses. So how can we be climate smart? How can we balance sustainability and resilience and achieve both goals? So when it comes to sustainability, we need to look at the environmental footprint, the greenhouse gas emissions of the health sector. And there are many different parts of the health system, the health sector, health facilities where greenhouse gases do emanate. And I will not go into the details, but as you can see, there are many different parts of healthcare where emissions are being generated, from the electricity that we use all the way to the food that we serve to our patients and staff, the pharmaceuticals that we purchase, the devices, the IV tubings, the waste that we generate, among others. It has actually been estimated that around 5% of the global greenhouse gas emissions is attributable to the global health sector. And so we really have an important role to play to stop climate change, to reduce the environmental footprint of our sector, and to be a positive example for other sectors to do the same. We also need to build climate resilient health systems. As I've mentioned, resilience, bending without breaking. We want the health system to not collapse, but recover and recover better than before, and even transform when facing climate-related shocks or stresses. And on your right is a listing of what are the things that we can do within the health sector to build resilience, to address the impacts of climate change, to withstand the effects of climate change. We need to address the social and environmental determinants. We need to invest in health promotion, intensify disease prevention and control, enhance disease surveillance, strengthen facilities, diagnostics, and supplies, equip the health workforce, including ourselves, family physicians, improve diagnosis and treatment, especially of climate-sensitive diseases like heat-related illness or dengue. And we need to meaningfully engage communities who are the first line of defense against climate change and its health effects. We need to add a climate lens into the different building blocks of the health system. I will not belabor you with the details, but some of the building blocks that are important include the infrastructure, the health services, and the health workforce. We need to be embracing the use of climate data and making sure that climate data informs the way we plan, the way we decide, the way we operate within the health sector. I invite you to visit this website, the Hazard Hunter PH, which is developed by our very own Department of Science and Technology. And what I actually did here, I'm from Calamba, Laguna. I tried to simulate flooding in Calamba City. If climate change is going to worsen, what's going to happen in my locale? And as you can see, many of our health facilities are at risk of flooding or inundation. And so tools like this can help us make decisions on where to build our future health facilities, where to move or relocate our health facilities, which hospitals need to be relocated or to be made more disaster-proof, among others. And we need to make sure that our actions in primary care contribute to climate mitigation, again, lowering the carbon footprint or environmental footprint of the health sector, but also contributing to adaptation, making sure we're able to respond to the health effects of climate change. Primary care is the foundation. It doesn't start in the hospital alone. It doesn't happen at the level of the Department of Health. It has to happen at the level of community and local health systems and clinics. And this is why family physicians do play an important role in climate action for better health for all. And in fact, you may be familiar with Barbara Starfield's 7 attributes of primary care. What we did is to add an 8th attribute, which we describe as planetary healthcare, embedding this kind of thinking that cares not only for people, but also for the planet in the way we redesign primary care in the 21st century. I invite you to take a look at this article that I co-wrote with members of WONCA and the Planetary Health Alliance. And we need to educate the future health professionals to prepare them for a warming planet. We also need to re-educate ourselves. And that's why I'm really glad that PAFP is now putting planetary health at the heart of its agenda. And I just want to show to you some of the emerging frameworks for planetary health education. What is important is that we are centering the repairing, the restoration of that broken interconnection that we have within nature, as you can see in the diagram on the right. That is really at the heart of this. If we see ourselves as part of nature and that we want and we aspire to live in perfect harmony with it, then everything will follow. All the technical solutions, the behavioral changes, the reforms in policy and practice. I invite you to visit the Southeast Asia Climate and Health Responder course that last year we co-developed with Columbia University. And you will see all the recorded lectures. It's available to all health professionals for you to expand your knowledge on this new nexus of climate and health and on the many different ways by which health professionals can contribute to addressing this pressing existential challenge of our time. And as you can see, also medical schools now are looking at their curriculum, their planetary health and climate and health curriculum. There's a planetary health report card that ranks medical schools in the United States. I think we should do the same thing for the Philippine medical education and health professional education in general. While in the previous slides, I showed to you the many different actions that we need to do in order to fix our own backyard. We also shouldn't forget that addressing the health of people and planet requires cross-sectoral action, working with other sectors such as urban planners, the energy sector, the transport sector, agriculture and forestry, as I already mentioned to you a while ago, the planetary health diet. And when different sectors work together, we will not only stabilize our global climate system, our broken environment, but also we will be reaping a lot of health benefits, physical and mental health benefits for our populations. And so in the Philippines, we created this network called Planetary Health Philippines, which brings together advocates, scholars, practitioners from different disciplines, different sectors, and even different generations to work together towards addressing some of the shared challenges. Many of them we already described in this presentation. I hope PAFP will become a planetary health organization. And at the global level, your mother organization, WONCA, is leading the way. And I'm really happy that for this year's World Family Doctor Day, the theme Healthy Planet, Healthy People was selected. There's actually a planetary health for primary care that I helped co-develop for WONCA. There's a declaration for family doctors to act on planetary health. There's a working party on planetary health. So I hope that PAFP will be involved in these global activities, but also that PAFP will bring these global activities to the Philippines, to our nation, and even to local societies. What we need is to localize all these global conversations, discourse, and efforts. I'm reaching the end of my talk, and these are some of my final messages. What we need is to establish resilient and sustainable planetary systems for health. We need to shift away from this thinking that the planet does not have limits, and therefore we can just keep on producing and consuming and destroying the planet. Instead, we need to shift towards this donut economy way of thinking, which I already described to you a while ago. Respecting the planet while protecting and preserving and advancing the health of people. I think we are now invited to recite a new Hippocratic Oath. If you remember, the Hippocratic Oath made a commitment, a pledge to do no harm to our patients. Now we also need to do no harm to our planet as well, on which our health greatly depends. And I invite you to look at this article that we co-published in the Lancet. We reimagined the Hippocratic Oath and turned it into a planetary health pledge for all health professionals in the era of the Anthropocene. When we say Anthropocene, we now live in this era where the changes happening around us are greatly influenced by human activities and decisions, as I mentioned at the start of this talk. I think that planetary health is an invitation to planetary humility. It invites us to shift away from this egological perspective. Oh, we human beings are at the top of the pyramid of nature. We can keep on polluting, contaminating, destroying, killing, consuming, producing, etc. And instead, we need to shift towards a truly ecological perspective where we human beings live in harmony and greater solidarity with all creatures great and small, and all the other components of planet Earth are one and only home. And finally, I think that planetary health is a call for us to become good ancestors. What we want is that in 2124, which is 100 years from now, the children of 2124 will read the history books, will look back to the past, and they will say that the COVID and climate generation of 2024, which is all of us, which is the PAFP of 2024, have become good ancestors to them because we made the right decisions, not just for our own health, but also for their health and well-being and survival as well. Are we ready to become good ancestors and not selfish ancestors to these children and to the future children of the Philippines and the world who are yet to come? So together, let's advance the health of people and planet. Thank you very much and good day.